Pneumonia is a lung disease that results from infection and leads to inflammation in the lungs. It's a very dangerous disease that involves the lungs filling with fluid. Pus and blood build up in the alveoli and can leave the victim short of breath. In the picture on the right corner is the picture of an affected lung alveoli. Pneumonia is a deadly disease that is one of the leading killers in the U.S. It kills about 5 to 10% of the people who have it. People with health problems have the most risk of dying from it. People most likely to get it are people under the age of 5 and over the age of 65. Also, people with underlying health problems, including AIDS, diabetes, or cancer, smokers, and people with asthma. Pneumonia can sometimes be mild, but can turn life-threatening very quickly. Pneumonia used to be even deadlier than it is today, but when penicillin was invented, the death rate went down because antibiotics can be very effective for treating. It is usually caused by a bacteria or virus. Sometimes it is caused by fungi that comes into your body. Bacteria, viruses, and fungi can live in your nose, mouth, and sinuses and get into your lungs. You also may breathe in small drops that people have coughed or sneezed with the flu. It can also result from other diseases like the flu, measles, and chickenpox. The signs and symptoms include severe cough, difficulty breathing, severe chest pain, high fever, chills, loss of appetite, fatigue, sometimes nausea and vomiting, and loss of oxygen saturation in the blood. For the diagnosis, you may get a physical exam, which is when the doctor listens to your lungs to see if you have abnormal bubbling that signal the presence of fluid in the lungs. You may also get a chest x-ray, which tells if you have pneumonia, and they detect the extent and place of the infection. They look for inflammation of the lungs and thick fluid that makes it hard to breathe. There is a picture of a chest x-ray with severe pneumonia. You can get a blood test, which measures your white blood cells. You may get a mucus test to look for viruses, bacteria, and other organisms. Taking an oxygen reading to measure the oxygen saturation in the blood can also work. In treatment and therapy, some require hospitalization to administer drugs and supply oxygen. Taking antiviral drugs and antibiotics. These can be taken in pill form or intravenously in more severe cases. Oxygen given through a respirator or oxygen mask may be used to help with the breathing. Respiration therapy can help open the areas and soak in steroids and inhalers. Fluids can help loosen secretions. You may get lots of rest, but no cough medicine, because a cough medicine doesn't let body cough out the secretions. There is respiratory therapy and inhaler. For prevention, you may get vaccines which help to protect against bacteria. Avoiding close contact with people who have the flu is good too. Washing hands and keeping good hygiene. You wash the surfaces that are most touched, including a doorknob or counters. Keeping the body tough by practicing good health habits helps to prevent infection, and not smoking. The trends are all ages, both sexes, all races, but is most dangerous to elderly, people with health problems, and young children. It's a leading killer of children 5 and younger. In 2007, 52,000 people died from pneumonia, and also in 2007, 1.2 million were hospitalized.